Thank you. There you are. Good. Let's start this conversation on HIV and AIDS and the young people. And we know now 42% of infections are among young people. What is really going on? Is there not enough sensitization, or do people simply don't care anymore? That's the conversation we're going to have at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. Let me introduce my guest real quick, beginning from my right. Doreen Morais here, HIV activist and founder. I Am a Beautiful Story. Thank you for making time, Doreen. On this other side of my hand, on the left, Rebecca Nyankia is here, Program Officer, Adolescents and Young People at the National AIDS Control Council. Thank you so much for making time. And Daniel Nyingi, a digital strategist. Thank you so much for making time as well. Rebecca, I'll start with you. What are the latest numbers looking like? What's happening? What is the situation when it comes to HIV infections?
Yeah, so with HIV infections in the country, we have about 34,000 new infections in the country based on the last estimates that we had for 2020. And specifically for young people, we have infections that are about 14,300 infections for young people. And the country has come a long way in terms of making sure that we're reducing these infections, in terms of even the number of taking care of the young people and everyone else who's living with HIV in the country. We have been at a standard 4.4 in terms of prevalence, which means we're doing really well as a country, but so much still needs to be done, with a focus obviously on young people, just because they still contribute significantly to the new infections. Because you can imagine, of the 42%, like you said, 42% of the adult infections, so the total number of infections in the country, we're looking at, they're contributing 42%. That's almost half of the new infections in the country. So when you look at it in that way, we are obviously not doing very well. But in terms of the ones who are on treatment, we have about 140, if I'm not wrong, 1,000 who are on treatment right now. And as a country, we have about 1.4 persons living with HIV. So, I mean, we do need to take care of the young people, and I think that's something that is has become a priority now, because if we don't, as a country, we might not be able to financially sustain the HIV situation in the country.
Yeah. Daniel, what's the missing link here? Is it that we need to change our strategy when it comes to communication? Because you would think the young people are the most informed, but they're the ones contributing to the highest infection rate.
So for me, I feel it all revolves under behavior change.
Yeah.
Because you'll find that for us, we've distributed the condoms out there for young people not below 18, that is the young people in the regions, to use condoms, but they don't use them. They just stay with them, or they pick them, but in terms of usage, we are not sure if they use or if they don't use.
Yeah.
That is one. In terms of sensitization, we've tried to come up with various programs and communication strategies that are focusing on young people to make informed decisions. But according to the statistics, it seems it's not really working well. Not sure where the issue is.
Yeah. Mora, you know, I've seen you on Twitter a lot speaking about HIV and AIDS, and I must commend you. I think it is a very courageous thing to do. Most people would never do that. But what are you looking to achieve with all this activism that you talk about? Are you trying to sensitize the youth, or are you trying to tell your story? What are you trying to achieve with it?
I'm trying to achieve two things.
Yeah.
One, change the mindset of people about people living with HIV. Two, sensitize the young people to continue staying HIV negative. Because as Becky has said, if we continue like this, we might not be able to sustain the people living with HIV in terms of treatment and even care. We cannot, we won't be able to do that. So first of all is to try and normalize the HIV conversation, in that there are people living with HIV, they're amongst us, and they're normal people going about their normal lives. But it does not mean that you stop, you now become reckless and get HIV. No, it means you become more careful, uptake the prevention measures that are very much available, and basically just change your whole mindset about people living with HIV and the HIV response.
Yeah. But what has your experience been like? Because you've been very open with this, living with HIV. What has your experience been like?
Some people don't believe I have HIV. So they say the government pays me to encourage people living with HIV. And some people who actually believe I've gotten to tap into it, and they're like, we are living like this because we know that we can do it. We can basically, from your life of living with HIV, your whole life, we can actually do this, so that they don't stop taking medication, because we also have people who start medication and stop along the way, so they do not stop taking medication and they continue living a normal life like everybody else. Yeah.
So they say you don't have HIV because based on how you look? Or
based
what?
on how I look. So, you know, when HIV first came, there were the billboards of Ukimu, Naua, and this very bony man, and some people are kind of stuck there. And you know, even in schools, our education system taught us that people living with HIV are supposed to look a particular way. They lose weight, they don't have hair. So now when I speak about me living with HIV, they're like, no, you're not supposed to be looking like that. So there is that.
Rebecca, and this is the interesting thing. Are we still dealing with stigma all these years after?
Yes, and I think the dynamic for stigma has also changed, because just like as she was talking, you know, now we can't go around putting up billboards of a skinny man and saying Ukimwi Unaua, because that's not the face of HIV or the people who are living with HIV. So it's a very thin line even in terms of communicating behavior change, because before there was the video that was being shown in schools. I mean, the image of a person living with HIV was so grim, you couldn't think about, like, I don't want to be like that, you know. But now they're healthy, and so that's also something we're struggling with young people, because their risk perception is very, very low. Because if we say, for example, that if you get HIV, you'll be fine, we'll put you on treatment and you live a long, healthy life. So why not? What's the problem?
Yes,
you know. So yes, then what's the problem? Then I may as well then get infected, because they don't understand that being infected with HIV is not as easy as it seems, you know. And making sure that you're taking your pills every day, and that they're into treatment, and it's the same pills, the same time. So, you know, things like that. I think we need to also change how we're communicating to young people, and more have conversations around why they shouldn't be wanting to get infected with infections.
That becomes really counterproductive, but at the same time, it's a fact, because then how do you tell me that this is it's a bad infection when I see Mora, she looks fantastic, and I'm thinking, so...
Exactly. So then how do you tell a young person that there's nothing wrong with HIV, while we do know that, you know, it's not the best situation?
Yeah.
Also, among the young people, I feel there is some stigma even when young people are going to test. You'll find that young people will say, I can't go to test because my friends will see me going to test, and or they'll see me coming out from the VCT, and they're like, maybe you have HIV because you are from the VCT, and issues like that.
But now there are different ways of testing. I believe you have improved ways. There's AuraQuick, things people can do on their own, right?
I mean, you can test from home, but even after you test from home, you still have to go to a facility, because that's the only way, if you are positive, that they'll be able to put you on treatment. And also the self-test kits, I mean, they're good, but we have to get the information to a point where a young person is confident enough to take the test, because they know that if they do get a positive result, they're able to go to a facility and say, you know what, put me on treatment. And I think that's where we need, that's the gap that still exists in terms of getting young people to really think that, you know, HIV is something that, yes, it's fine if I'm infected, but not to want to get infected in that way, but also to seek medical care in that way. And I think that's where we need to get as a country, as we're doing communication for young people.
And so, Mora, the people you speak to, what are they most scared of? Are they scared of infections, or scared of pregnancy?
I think both, but probably pregnancy more than HIV, because they say if I get HIV, nobody will know I have HIV. I will take medication, I will look like you, I will not need to disclose to anyone, so I'm fine. And some people are even getting into marriages and staying in the same marriages without even disclosing to their partners. And it's just like we are living normally, they're taking the medication right with the partner, and the partner is not HIV positive, so they're like, okay, I can always do this. But now when it comes to pregnancy, and that is why we even are trying, the government is trying to integrate both the sexual reproductive health and HIV services, because some of these people look at pregnancy, you know, pregnancy has a consequence, which is basically a child. And bringing a child is something first of all, you don't want people to know you are pregnant, especially if you have set all these social media standards, so you don't want that. And people look at a child as a responsibility, while they don't look at HIV as a responsibility. Yet it is a responsibility, because you have to take your medication for the rest of your life. So they don't see the burden of living with HIV. they see the burden of a child, rather. So for them, they're like, ARVs are free. I get to take them whenever I want to take them. But a child, I have to provide for that child. I have to be there for that child and take care of the child. So I don't want that. So we are trying to integrate the sexual reproductive health and HIV so that all of this information is together. Because sometimes you find that I'm going to a CCC to get my ARVs, but then I have to go to the main hospital because most hospitals have CCCs in different blocks. So I have to go back to the main hospital to like seek a family planning method to get the information, and I don't want that because it will be seen like huyu ametoka kwa watu HIV and anaenda anaenda seek family planning. And sometimes the other day we were having a focus group discussion on both, and we looked at it like sometimes you find like healthcare workers tend to think that if you are living with HIV, you're not sexually active as a young person. So there is that integration that needs to happen.
Okay. So Rebecca, what has worked as a program officer for adolescents and young people over the period that you've done this? What has worked and what has not worked that needs to be reviewed?
Yeah, so in terms of what has worked and something that has been a success is engaging young people to reach other young people, what we are calling peer-to-peer engagement or using the human-centered design. So working with young people to reach other young people because their communication is the same, the things they worry about are the same, and so it helps that if you have a young person speaking to another young person. So that has come a long way now. And also the meaningful engagement of young people. Now young people are being put on tables that they would otherwise not be sitting at. They're having conversations with people that they would otherwise not be having conversations with, because we know the young people are a population that a lot of decisions are made for them, and from the time that they're children to the time that they're 18 plus, the decisions have already been made for them, policies have already been made for them. So now they're actually engaging in these processes, and it has shown such like a meaningful success because now they are designing programs that they want to be a part of and that they have created for themselves. So we have programs like Sauti Skika for young people who are living with HIV. We have Maisha Youth, we have Blast. So it's young people who are actually engaging in implementing programs, in designing programs, and coming up with policies that suit them and that also they are responsive to them. The other thing that has been really good in terms of working with young people or engaging young people is policies and making sure that we're putting together policies that actually work for young people. Like she mentioned, like Moram was talking about issues of integration. Young people have been asking for a long time, like, let's integrate this programming for young people. Let's not talk about HIV here, then we're talking about STIs on another space, mental health here, you know, so let's have this conversation, all of us together. And it's because for young people, the thing that's different from the general public is that the things that are around the young person or the levels of influence around the young person are more than just the school. They're more than just the facility. It's their friends, it's the decision makers. Everyone around this young person is making decisions for them. So we have to make sure that all these areas are covered. And I think lastly, which is the focus that NAC has, is a multisectoral coordination. So which essentially means that we're bringing on board all these people who are around the young person. So from the facility level, which means Ministry of Health, we're talking about Ministry of Education, we're talking about sports and culture, we're talking about making sure that we're mainstreaming youth issues, especially in workplaces, and giving employment. Because if you think about it, HIV is probably the last thing that young people care about. It's uko nyuma kabisa. Like when people think about HIV, when you ask a young person, we could even ask Nish. We call him Nish. Like, do you care about HIV? Money, you see? So it's money, it is how can I be able to buy a car, how can I be able to get a house for my mom, how can I, it's things like that. And then you find out that HIV is at the complete back burner, and they do all these things that put them at risk for infection, forgetting that. So we as the guys who are programming for them need to figure out how do we get all these other things that will help us make sure that the infections are lower. And so that's why we're doing multisectoral coordination, making sure that we are speaking to every other sector but health. Then now bringing in health to hear these issues so that we can be able to come together and form solutions for young people in the country.
And Dan, it's an interesting thing that you bring up. What are the priorities for the people, young people like yourselves who are dealing with the issues of life? What are your priority areas? Health doesn't come first. So
health doesn't come first. As she said, there are so many issues revolving around the lives of young people that lead to this, maybe HIV. One is unemployment, poverty. You'll find that nowadays young boys wanaenda na wamama, young girls wanaenda na wababa just for money.
Yeah.
And they don't have even the bargaining power to bargain for a protective measure while engaging in the activity they will be engaging in.
Yeah.
So there is money, there is also education at some point. You'll find even some in some areas we'll find that the cultural issues also affect. This dynamics also affect the young people, and you find that they will engage in immoral behaviors.
Yeah.
That will lead to HIV or other diseases.
Yeah.
Just in the name of having fun or focusing on what you want.
Yeah.
Yeah.
Rebecca, what Dan is saying is very interesting. How have you dealt with the aspect of culture and the aspect of poverty? Because some people simply tell you, I did this because I had no other choice.
Yeah. So we do have some programs that for in communities where there's issues of poverty and not being able to meet basic needs, where we do provide basic needs through organizations such as the USAID programs that do focus on making sure that young girls, for example, are given income-generating activities or resources or skills to help them be able to make money, so they don't end up, doing getting HIV through activities that sexual activities that might actually put them at risk. So we have programs like those, and then we also have issues around. You said there was poverty. Sorry, the second one was
Culture.
Culture. So with regards to culture, so I mean culture, especially in this country, when we talk about culture, we forget that, like for example, with HIV, you have to talk about sex. Yeah. And as a nation, sex is something that is very taboo to discuss. We frown upon it. So what we're trying to do is sensitize communities and sensitize even through the Ministry of Education, the students, so they're able to have these conversations and be able to actually seek medical care. So for example, we do sensitization with the Ministry of Education. We work with young people in this community. So just, I think recently we were having a meeting with Lekiampu from Wajir, Isiolo, where, I mean, culture plays a significant role in terms of how they come forward in terms for testing or for getting ARVs, working with those young people and making sure that we are hearing what they're saying and how do we communicate to them. So, for instance, if the men in the room don't want to speak to the young girl who's sensitizing, then we get a man to sensitize them in such a forum. So we are trying to be as sensitive as possible as we can with regards to culture, but also making sure that they understand that there is a problem. And whichever way works for them, so through the human-centered design, for example, understanding what the community needs. So in as much as we want to sensitize you in this community where maybe certain things are frowned upon, we first have to understand what is frowned upon, and then from there we're able to then design a program for you that will work for you. So we're making sure that we are listening to what the community needs.
Okay.
Yeah.
Mora, run me through your story. You're also a founder of I Am a Beautiful Story. What is that all about? Just give me a brief history of how you ended up where you are.
Well, I founded I Am a Beautiful Story when I first started sharing my story to the public, to basically encourage people living with HIV like me that there is a life beyond our diagnosis, and that you can still get to take your treatment, you can still get to live a normal life, you can still get a chance to do everything you want to do in this life, and HIV is not your limiting factor. So I basically just want to give a face to a virus that a lot of people are shying away from talking about, because right now, today is the last day of the high-level UN meeting on HIV and AIDS, and they are all focusing on the gaps that have been left 40 years into the pandemic, because it's been 40 years. What has worked, what has not worked, where are the gaps? And now the problem is there are more emerging issues as time has gone by, and those are the issues that we are now trying to come out, to bring out, so that we solve them and end AIDS by 2030. And by that, it means ending the inequalities that have been presented themselves. And when you look at it, you are like, the emerging trends tend to affect HIV more. Because if you look, right now we have COVID-19, which is affecting people living with HIV, both economically, socially. Some people even stop going to hospital because they're afraid if I go to hospital, I'll catch COVID. So you see, there are all those complexities, and that is one of the things that I try, because I am the face
Yeah.
of I Am a Beautiful Story. So I try as much as possible to encourage these people. It doesn't matter what is happening. Let us continue taking our medication.
Yeah.
I try, especially on my YouTube channel, I talk to diverse people. I've done an interview with a sex worker. I've done an interview with a gay man living with HIV to bring in the aspect of people living with HIV in all their diversity, so that you see that it's not just people living with HIV. We have different diversities and we have to address them.
Yeah.
Because if we don't address them now, we will go another 40 years still trying to figure this thing out.
How did you find out you were infected, and what was your reaction at that point?
Well, I didn't find out. I was told.
Yeah.
I was told I'm living with HIV when I was 13, but my parents found out when I was 8 that I was living with HIV. And the first time, I honestly didn't behave, like it didn't hit me like a bad thing. Because at that point, I did not see HIV as a barrier in my life. It was a little bit exciting for me because then I started ARVs officially. And before that, I was taking Septrin, and I never liked Septrin. So ARVs kind of excited me, and that time we started with regimens that were very colorful, and for me as a child, they made me happy. And then my mom used to take me to hospital every month, so that was guaranteed. I'd meet school at least once a month, and it was a nice thing too, to me at that particular time.
School, at least.
Yeah. And also the treats that came with traveling to the hospital.
Yeah.
So those are things that actually made me happy. But now, as a child, I did not understand that there is stigma.
Yeah.
That the world will never see me as a normal person. They will always look at HIV and then look at Doreen. And that is one of the things we are trying to like abolish, because on Wednesday we were attending the Maisha pre-conference.
Yeah.
And somebody spoke and said we need to look at the human before the HIV, because we tend to mix them up. But no, this person is a human being before they're living the HIV. So if they're a human being, they're able to date, to get married, to achieve whatever dreams they have in life, to become a successful business person, or to get like their dream job or travel the world, whatever it is that they want to do. But most of the time we tend to look at the HIV more than we look at the human aspect. Yeah. So it is, and I like how Becky says that we are now integrating the human-centered approach, so that it doesn't look like a statistic, because for the longest time ever, we keep dealing with numbers. These millions of people living with HIV, where are the millions of people? We want to see their faces. We want to see them speak, so that they don't end up to be like, we don't behave that it is those people's problems, but it is our problem, whether you have it or not. If you're not infected, then definitely you are affected. So as a child, it made me happy that I had all these perks that came with it. And then growing up and realizing the burden of taking medication every day, the burden of people looking at me as a person living with HIV, it didn't make me happy after that. And that is why I stopped taking ARVs and went to Loliondo and drank the Loliondo cup and stopped taking medication altogether.
How did that turn out?
It turned up with an opportunistic infection at the end, 2 opportunistic infections actually at the end. And then the doctors looking at you and telling me, why did you stop taking medication? And I was like, you know, when the first time the doctor told me, you're living with HIV and you had to take this medication for the rest of your life, I did not bargain for more than 5 years. You see, at the back of my mind, it was not going to be something long-term. But I got tired, and a lot of people get tired. Then they seek other services. There are places where you cannot really give them ARVs. They're like, us, we will drink our miti shamba and we will be okay. And then this person dies, not because of HIV. It's because they refused to go and take the ARVs. So for me, that time, when I saw Babu Loliondo, I saw this is my golden cup. This is how I turn HIV negative. And that is why I decided to seek him as a service. But unfortunately, I did not get cured. Even if I stayed 2 years away from ARVs, I looked at it as maybe the medication, the Babu cup is taking a while to work. But unfortunately, it was just not working. It was not a cure.
So when you got there, but there were many people, there
were millions of people going to that place.
How long did it take you to even see him and get that cup?
We reached there on, I think on a Monday evening.
Yeah.
We saw him on a okay. He used to call everybody who was on the queue going for the cup. You will be called like a kind of an assembly, and then he talks and tells you he does not have a cure, but our faith has already cured us, and then we're going to pay him 100 Kenya shillings and drink our cup and come back home and we will be healed.
Oh, wow.
So it was supposed to be very easy. Unfortunately, it was not working.
Becky, it is these theories that then are almost counterproductive in the fight against HIV, right? Are we now giving people a direct, straight instruction? If you have HIV, take your ARVs. Simple.
Yes.
No other direction.
It's
out
really
of
that simple.
Yeah.
I mean, if you're tested and you turn positive, you're put on treatment immediately.
That's it.
That's it. And the treatment now, and this is something I've also heard in terms of just the time I've been working in HIV, but also from the people who've been in this space longer than me. I mean, now it's better than before, where people used to take almost 13 tablets or more every day. And you see, now it's easier. You can get 2, or you can, it's 2 or 1 if I'm not wrong. One. So, you know, like, I mean, it's better now. So it's just take your treatment and you'll be fine. Yeah. It's really that simple. Okay. Yeah.
But then the testing part is where the issues are, because people think, in fact, right now, just the other month, there was still a standoff when it comes to ARVs. How did that impact your fight against HIV infection in the young people?
Yeah, I mean, I think with regards to the stand for ARVs and the ARVs that are at the port, which is a situation that has been in the country for a while now, and we've been, you know, having conversations about it. It obviously brought to light the fact that we do, I mean, depend heavily on donor funding to take care of the HIV situation in the country. Yeah. I mean, we are grateful as a country. It's not that we take it for, you know, granted that, you know, we're able to, you know, for a long time depend on the support from donors. But in terms of what it brought to light for me specifically was the fact that we really need to focus on sustainable funding and funding within the country for HIV to make sure that we actually are producing HIV ARVs for our the people who are living with HIV in the country. And how do we make that possible? You know, do we set aside enough resources as a country, because there has been advocacy around resource mobilization and making sure that we do have enough resources and financial resources, that is, that we can be able to provide ARVs for all the people who are living with HIV in the country. So as of now, I mean, I think that's something that has come out very clearly for the country, that we do need to set aside significant resources to make sure that we can cater to the people who are living with HIV. But more so, just as I said earlier, we won't be able to sustain this numbers of infections that are happening in the country. It really, I mean, we're already depending on donors, and then here we are not closing the tap on prevention. You know, there's more and more. If you're talking about 34,000 every other year is a number that we can't manage, you know. So we actually need to focus on how do we prevent HIV. I mean, that's the focus right now. How do we prevent HIV? Because the more new infections we keep getting year in, year out, then the money we have in the country will never be enough to take care of the people who are living with HIV.
Did this number surprise you? You talk about 34,000 infections in a year. You know that is about 94 people every day.
No, it is high. I mean, even for young people, which is
2 hours
2 hours every
people per hour.
2 people every hour.
2 young people.
Yes. 2 young people
not,
every hour.
Not the general public.
Yeah.
Like, that's 15 to
24.
15 to 24.
Yes.
2 per hour.
2 people getting infected every hour.
Every hour.
So in a
so
day,
in the
that's
last
24.
1 hour that we've been having this conversation, 2 people have already been infected. But who's transmitting these infections? Is it because there was also another research that I saw that they were saying that the highest rate of infection is within married couples? You know, this Mpango Kando thing that is happening right now?
So you'll find that there's an example, me and Becky, maybe we are married. Becky has her Mpango Kandos, I have my Mpango Kandos. So for Becky, there's someone they go with raw, there's someone I go with raw. But besides ourselves, same case to that person, he has another person. So it's a chain. Yes, it's a chain.
I think for young people especially, I think the mpango kando was a while back,
Yeah.
because that was when the infections were not high among young people. They were among the older generation.
Yeah.
But then now with the infections among young people are not having sex. We think that they're having sex with people who are much older. They are. There's obviously transgenerational sex where we have young girls and young boys having sex with older men, older women, but it's also among themselves.
Yeah.
It's also among themselves. Because if you really think about it, between 0 and 14, maybe they were born with HIV. Between 15 and 24, where did they get it? It's obviously unprotected sex.
Yeah.
And it's among themselves. They're exploring together. They're asking each other those questions that they can't ask anyone else. So they're having sex with each other.
Yeah.
And so what that, I think, means for me, and we always had the notion that young people think about sex so much, that they plan and they prepare. I don't think they prepare.
They don't.
Their sex is the most, I think, spontaneous, ad hoc, all the time, anytime.
Especially because of peer pressure.
Yeah.
Wanapatana wakiwa wote, then they discuss how person had sex, and then you are like, the person who is left is like, I need to try this.
Yeah.
That peer pressure leads to them trying.
Yeah.
And the young people are fond of trying every new thing that they find.
Yeah, it's true.
Yeah.
And then they're misinformed as well, and their
Yeah,
risk
true.
perception, like we said, was really low. So you find that young people are having sex with each other, and they don't have the correct information. And so I think, and for me, something that has been like an interesting focus for me this year or the past couple of years is boys. When you look at the statistics, something happens with boys after 19. Like when you look at infections, maybe when it's sort of like a 50-50 from 0 to 14. But when 15 to 19, 20 to 24, the infections for the boys start to rise. And there's obviously something that happens at that point. And I think, so I'm very excited right now to have conversations with boys and try to understand how we can design programs for them, because you have so many programs for adolescent girls and young women, but we forget that the partners of these girls and young women are the young boys, and how do we reach these young boys? So that's something that I personally am very excited to have a conversation about. And yeah, and maybe I don't know whether it's a good time to talk about a panel session we'll be having during the Maisha conference. She mentioned they had a pre-conference, so we'll have a panel session for boys, because I think it's about time we have conversations about boys and men. And what their role is in the HIV response.
Okay.
Yeah.
We're coming to that in just a bit after this break. Let's take a quick break here on Daybreak. When we come back, we're talking about HIV infections among the young people. What strategy do you think should be deployed now to change this conversation again? We know that 42% of infections are among young people. Send in your views at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. Engineer Lazaro, I see what your comments are. We will read them in just a bit. All right, thank you for staying with Daybreak. We're talking about HIV and AIDS and the infections among the youth and the risk perception that is increasingly becoming low, and yet the infections are rising. We'd like to hear your views. How should we change this conversation and change the narrative and make people see that it is important that they take care of themselves? Infections are still rising among young people, married couples, across board. Omolo Rogers Shamar says one of the contributing factors to HIV among young people is poverty. There's no economic intervention, especially in Homa Bay. All right? We'll speak about that in just a bit, where the infections are rising. Calvin Otieno Oko says it is motivating and encouraging to see people who are HIV positive living positively, contrary to some HIV negative people living negatively about the virus. Let's climb at the top of the highest cliff and tell the country that being HIV positive is not a death trap. Engineer Lazaro says that COVID-19 shouldn't make the government lose focus on the dragon sword of HIV. Good numbers of youths are sexually active and very reckless. HIV issue should be confronted with the same energy we are applying facing COVID-19. Yeah, Mora, walk me through your experience. So we've mentioned that before it was 13 drugs, and then it came to a lower number. Where did you start, and where are you right now?
So I started my medication in 2005, and I started with 6 pills, then came down to 4, then 2, now I'm at 1.
Okay.
Yeah.
How was it continuing with that therapy? Because I'm sure, did you ever wonder, where will I even keep this medication as you're growing older, with the people you're meeting in your life? Did you find it difficult to explain to them that I am living with HIV? And what was their reaction? whenever, because you're a young girl,
Yeah.
so I'm sure there are many people who come to you trying to date.
So growing up, when I went to high school, I lied to the people I was with in high school, and I told them this were medication for a heart problem. So, you know, nobody ever stigmatizes you for having a heart problem. So that was actually very smooth, because I got the PT, I got the help, I got people asking how I am feeling and all that. So it was actually nice to get that attention of, we have somebody with a heart condition, even though it was not a heart condition. So after school now is when the reality hits you, and probably why a lot of people even stop taking medication after school, because now there is nobody to micromanage you on, did you take drugs, did you not take drugs? There is also the issue of you can always skip, you know, especially you're in college or you're in campus and people are going out to party. It's your time to take medication, but you can't, because you're there with people. So you have to hide in order to take the medication. So some days you skip, some days you take them. So it's never like, you're never consistent. And you need that consistency in order to become undetectable. Yeah. So that consistency always lacks, you know, when it lacks, then definitely you're exposing yourself to more opportunistic infections, and that is the point where a lot of young people fail on treatment and are even pushed to second-line medication. So for me, even in college, I never told anybody that I had HIV. Yeah. So, and I was living on my own, so nobody really, it was just, sometimes I take, sometimes I don't take, depending with how I have woken up that day. Yeah. And then, now dating became hard, because maybe somebody calls you to the house for a sleepover. You can't really go there with medication, and the medication makes so much noise in the containers. So this person will be like, okay, what are these and what are they for? And maybe if you have not disclosed, it's a little bit hectic, because the disclosure, even though we say that we need to like disclose more, talk to people about your status, like make them see that there's nothing wrong with you and all that, but not everybody is going to take you living with HIV as a good thing. Yeah. Because some people get shocked. Sometimes you disclose and people don't even believe you. I told you that people say, I don't look like I have HIV, because they assume I'm supposed to look a particular way. I once disclosed to somebody, and he did not believe me. In fact, he said I was using it as a reason to just reject him. So the first agenda on our first date was to get tested. Yeah. And we got tested, actually. We actually just told the doctor, cut on the counseling, just goes direct to the testing. So we were tested, and that time I had defaulted. It was the time I had defaulted on medication. So I knew that even if it will take a miracle for me to even get a false negative HIV test. So the test came out, mine were 2 strong lines, his was 1 line, and he did not even believe that what I was saying was true. And the ride from Ngong Road to town was very long. If there was no radio in that car, I do not know what would have happened. Because he literally left me here at Hurlingham shopping center. And he was like, you know, just go to town, we shall talk, I have some things to do in the office. And that was it, you see? And that is why a lot of people fear the rejection. Yeah. So that rejection part, you're like, if I disclose and this person leaves me, then I probably might not be able to handle more rejections to come. So that is why a lot of people are like, I will not tell this person, I'm undetectable, I know I will not transmit to them, but the disclosure is, it's a method of also self-healing. Yeah. It's just that a lot of people, a lot of times we don't look at it from that perspective. We look at the stigma angle. But if you manage to disclose, you have managed to actually end self-stigma. Yeah. So what is left is for the society. But also society will treat you how you treat yourself. Okay. Yeah.
And Rebecca, and that's an interesting aspect, because most of the counseling sessions that come, they are mostly going to talk to you about how to take your medication, what to avoid so that you're okay. Nobody addresses the softer aspects of things. Yeah. So if you're going to date, do you expose that? And when you disclose, what are the likely repercussions and how do you deal with them? Yeah. So how is the National AIDS Control Council dealing with the softer aspects of things?
So I really like what you've shared with your story, because those are some of the the real questions. That's basically answering the actual real questions. I mean, fine, I've tested positive, so then what?
Then what?
You know? And so with a couple of young guys, we were able to develop a toolkit, an advocacy toolkit for young people, for them to be able to do peer-to-peer work. And some of the things that we were very keen in ensuring were in that document were basically, how do I live positively? I'm living with HIV, but how do I live positively? How do I, like, what does that mean for me as a young person? Can I date? And so it sort of demystifies issues around dating while you're living with HIV. Basically talks about, so I'm positive. Now, does that mean that my life completely changes? You know, so it basically touches on the softer skills that you've mentioned. And it's an amazing document that we worked on with very young people from around the country. And it's what we've been using for the peer-to-peer work, because we basically understood that it's more than just the diagnosis now. It's more about how do I continue being a productive person and be a positively living person, but make sure that I am actually contributing and having a full life, you know. It talks about dating while you're living with HIV. Can I then have sex with my partner if both of us are HIV positive? Basically answers those questions. And I think that's one way that we went a step ahead of just telling people of the numbers and what it's like, the signs and symptoms and things like that. And and I think that toolkit has really helped us basically make HIV something that young people can interact with and actually have normal conversations around without making it seem so grim and so difficult for them to understand.
Yeah, so typical example, a young person comes to you and tells you that, yes, I am HIV positive, I am this person I want to date. Do I tell him or do I tell her?
So I think so for me, I would say, where are you at with your relationship? Because obviously, if I've just met you for the first time and I immediately disclose to you, there's just like she said, immediately I'll be like, okay, yeah, maybe we should not be having this conversation. So you obviously have to form that level of trust in that relationship where you feel that your partner will be open to that. Then, after you feel that you're at that point, you also need to be comfortable with yourself in terms of, the way she said, self-stigma has, like by speaking on your disclosure, then you've sort of put aside self-stigma. Then you have to be okay with the fact that your partner might not be okay with your HIV status. That's something that's also outside, that's growth outside of you as a person living with HIV. It's you as a person. You have to be okay and understand that, yes, my partner might not be okay with this situation that I'm in right now, and that's fine. So that's where the whole understanding of the human, like understanding the person first, growing the person first before talking about HIV. Because it doesn't matter how, even if I'm HIV positive and I have not accepted it for myself, or I've not matured myself emotionally enough to understand that my partner will not be okay with this, we need to take care of the person first. So for me, it would be making sure that me and the other person that I'm telling my status, we are at a place where I can trust them with my status. And secondly, myself as a person, or the person that I'm speaking to, understands that the other person might not take it well, and it's okay. Because we're not both at the same level, and that's okay.
But then this becomes more complex if you're already in a relationship, and all of a sudden you realize that you are infected and you had tested earlier on. Because now that comes with an absolute breakup.
So for me, I feel disclosure is a process. It's not a thing to just rush and tell your partner because you love them or because you feel you should tell them at that point. So you should first understand each other and see and weigh the options and how will they react after you tell them you are positive, or what is their understanding of HIV. Also, it also matters a lot if they have the basic information of HIV, because if they don't have, they will automatically reject you.
So this is something you have to be able to live with, and you have actually lived with that in yourself. And so how did you get over it? Did you get counseling? Did you encourage yourself? What happens? And now when you meet someone new, and we've seen all the updates that we have for yourself on social, isn't that the first question that you get?
It is. And if it's not, then it's definitely somebody telling me, I like you despite your status. So you see, despite your status, it means basically that my status is a limitation. And at some point, they're going to look at it as a limitation. So you must, personally, I don't even know how I managed to come out, because nobody guided me through, you're going to speak publicly, you're going to tell strangers. Some of them have misinformation and misconceptions about HIV, and you have to live with it. You know, you have to let them know that you're okay with your status and there is nothing wrong with you. the first time I talked about my story publicly was I wrote an email to an editor of one of the local dailies. We had gone to test people in an institution, and everybody was afraid of getting tested. So, like the place we had been given a place for, we put up tents and all that. Nobody was coming to that part of the school. And I'm like, what is happening? Are these people not learning or anything? Yeah. So we decided not to go to their classrooms and talk to them and tell them, hey, what is happening? We have a free HIV test going on in the school. Yeah. Come, get tested, get counseling, get free condoms. And they tell me, I've not done anything. I'm okay. And you ask them, when was the last time you got tested for HIV? They're like, I've never really gotten tested, yeah, but I know that I am very fine. So when I was now talking to my boss and telling her, this is the situation on the ground, a lot of young people don't want to know their HIV status. And she told me, how about to try a different strategy? Yeah. Give them your story and let them see you're a person living with HIV and you're okay. And then maybe that will prompt them to go and get tested. Because a lot of people tend to kupima na macho. Like, this one is okay. And then, and asking each other, babe, how many trust? You know, such kind of things. And those are the kind of things that have actually led people to be on ARVs, because you look at each other, you agree that you trust each other, and the few months later you find out you're living with HIV. So when my boss told me to come out publicly, I was like, no, I cannot really do that. Yeah. Because the first stigma I actually faced was from my family members. Yeah. On the seclusion of utensils, disinfecting of my clothes, you know, such kind of things. So when it is your family stigmatizing you, it is hard for you to actually face the public, because your family is supposed to be your #1 support system. And in this case, it's not. So talking to people became a little bit hard. So when I actually said, let me just write an email to this lady, I wrote the email with my story. At the back of my mind, I did not write it for the story. I wrote it as a way to, let me try and just share it with somebody who does not know me. Yeah. I never thought she would even open that email. And then she opened the email and responded. And I was like, am I really ready to tell Kenyans that I am living with HIV? Because it's still being seen as a big deal. So we did the interview. At first, it was supposed to be on print, and then they told me, no, we're just going to upload it on the digital platform. I was like, okay, fine. Digital, nobody will read it. And then they shared it on the Facebook page. And everybody was tagging me. These people, they're spoiling your name. You don't have HIV. Why are they doing this to you? Come and sue them, and all those things. So I was very, afraid. I basically just deactivated my Facebook account that day. And when I came back, now everybody knew I had HIV on social media. And now I had now to show them this aspect of, yes, I have HIV, yes, I have lived with it. And now when I speak about my parents being a discordant couple, people still like, how are they a discordant couple? You know, like what happened? How can you explain it? And sometimes you are not even able to explain it, because these are my parents. Yeah. There are a lot of things that I might not know. So trying to explain that and telling them, no, my parents are a discordant couple, which means you can be a discordant couple. I am a person living with HIV, which means you can actually live with HIV normally, and there is nothing wrong with you living with HIV. But then also there is the way people perceive you, in that you just, like, they don't look at you beyond HIV. Yeah. They just look at you and they look at HIV. And some of them come to you with very complex situations that I have never faced. Yeah. And they're asking me because they expect that I know all the answers to their questions. Yeah. Yeah.
I find this very strange that your own family stigmatized you. Yeah. And when you talk about utensils, what was that about? Were they keeping them on the side? How did that happen?
So my brother had died. In my family, it's just me and my late brother who got HIV. The rest of them are HIV negative. So when my brother died, I went to live with one of my relatives. And when I tested positive, my mom happened to disclose to everybody else in the family that I have HIV. So when I went to live with them, I think they never really, you know, that those were the times when HIV was very feared, and they never really got to understand what it's all about. So I was living with them, yes, but very secluded. So I had designated utensils in that house that I would eat with, and they will be disinfected, and sometimes if it's during the day, they will be put out in the sun so that whatever viruses are in there die. I never knew why they will think that HIV will be transmitted through utensils. Because I remember one time, well, it's the lady of the house who had put those rules. So one time, my uncle came with a soda, and he gave it to all of us with the different cups. And I was given a new cup. And that cup became mine that same day. Because I was like, why did you drink from a cup that it's not yours? So now I had 2 cups in that house.
Wow.
Yeah.
That is the hardest thing someone has to go through, and I don't even know what to say. Rebecca, these numbers that you were talking about, what was the most perplexing for you? You said 1.4 million people live with HIV, 34,000 infections. In fact, you're saying it's 41,000.
So it's 41,000, yes.
Yeah.
It's 41,000 new infections in the whole country, but the 34,000 are from 15 and above. So basically the remaining is between 0 and 14.
Yeah.
So I think for me, the numbers that are quite shocking to me are really the infections among young people. And for me, it's because that the fact that the Kenyan population is growing significantly. And the people that we're talking about, the 15 to 24 who are contributing 14,000 new infections in the year, are basically people who are, well, there's about 23 million of them. And if we keep at it in that way, this population that's supposed to be the most economically viable, so the people who are working in the country, so the people who are supposed to essentially move us up with regards to our sustainable development goals, it essentially means that our working population is going to we are not going to be able to sustain them. And for me, that's quite shocking for me. And I think we need to start focusing on how we can prevent HIV infections among this population and what we need to do. And whether is it that what we are doing right now is not working well enough, or do we need to, increase the intensity that we are passing this information, but also the fact that we need to work with young people who are living with HIV to actually share the stories in the way that Mora is doing right now, to basically tell young people that it's not that okay.
Yeah.
It's really not that okay. Yeah. Because now we have to move from telling young people that, you'll be on medication and you'll be fine. But there's things that come with taking that medication. And for me, I think that's something that we need to start, highlighting a bit more, because it answers the question for young people, why?
Yeah.
The why question. Yeah.
But how much of this is based on resources? Because we can break this down into little places and have youth groups that then sensitize each other. But is this pegged on resources or just goodwill?
So both, and I think most of these young people or the youth networks that are working in this space end up having to work out of goodwill. Yeah. Some of them end up having to do this work without being essentially paid, and so they're volunteering or in spaces where they're given maybe an allowance here or there. But I think it is pegged on resources, because it takes, we're basically asking either Mora or Daniel to leave whatever other thing would be giving them any form of income to go reach out to their peers, which essentially means that we have to actually budget for that, because in as much as we are spending money on other things, we need to actually put money in these places that are working, and so it is resources, and it's resources that as a country we're already straining with in terms of allocations for health and things like that, but also making sure we're putting this money where our programs need this money. Okay. So we need our resources to follow the programs that are there for young people, and have, if our focus is on making sure young people are reaching other young people, our money needs to follow that direction. Yeah. So that our money is actually being used by young people to reach other young people, because that has shown to be quite effective in terms of the support groups and the youth networks and the groups that are working in different counties and regions to reach young people with information.
Dan, do you think HIV and AIDS conversations have been prioritized enough from your perspective?
So I started working in this space back in 2017, and ever since then, since you find that most of the activities that you are partaking in, you're not reimbursed. So you find that young people join to participate in the sensitization activities, but they get to a point and give up, stop pushing the message, and that you find that there is a break of communication when that happens. So now you need to recruit more young people without the finances also, and they won't also get to the end. They will get to a point and they will give up. Yet, this peer-to-peer model, it seems to be working.
Yeah.
When you go to the young people and you tell them, among 10 young people, 4 of you, amongst 10 young people are positive, they get that psyche to go and pass the information to the other young people.
Yeah.
But now, due to lack of finances and the rate of unemployment in our country, you'll find that these young people will give up along the way and communication breaks.
Yeah.
Yeah, maybe just to add on that, so I think that we also just have to appreciate that the engagement of young people has come a long way. And it's not that, I mean, before it wasn't there, and I think he mentions 2017 because that's when we had the first youth-led pre-conference, and it was the first time that young people were actually brought together to sit with policymakers and to have like actual conversations and basically ask, where is this money going? You know, because we are still the ones who are the most affected. So I think that steps have been made towards engaging young people more, and I think so I don't want to like in any way put down the statement that you've made, but just to say that we are making steps in making sure that young people are engaged and engaged meaningfully in a way that they are going to continue contributing to the HIV response. So for one, by building a model for them through the peer-to-peer work, giving them the resources in terms of skills to be able to meaningfully engage, but also more than that, trying to set aside resources within the allocation that's given so that we make sure that we are advocating for more and more resources being put for young people, for them to be able to implement programs. So steps have been made in making sure that we are engaging young people through, for example, the Global Fund process that has just been concluded. So there's issues, the issues that young people are raising are being heard. And so since there hasn't been a framework for engaging these young people over like a while since people started working in HIV, I can actually say that now we are working with young people. It's not obviously where we want it to be or where they would like it to be, but we are working with young people.
Steps.
Yes.
Based on the research that you've done, which counties are most prevalent when it comes to HIV and AIDS infections, and why?
Yeah, so when you look at the new infections in counties, obviously there's the ones that have always been at the top of the list, Kisumu, Homa Bay, the Kiambu, Nairobi. These are, if you look at it nicely, these are counties that are also either very urban or they are also very, they're near urban areas. So the thing, for example, like Kiambu and Nairobi, there's a lot of schools. There's a lot of schools, and there's also a lot of movement from county to county, which essentially means that even if you're in Nairobi, you're probably going to school in Kiambu, so there's movement of people within those areas, and then also the fact that they're very urban. And then there's also counties where I've had stories that if you're the one who doesn't have HIV, then you're the one who's not with it. So there's a sense of, we are okay to take this medication, and it's fine. So there's the feeling of that HIV may not be as bad as we think it is. And so we end up having more and more infections in those counties. But the counties that have the new infections are higher in, we obviously have issues around the fact that they're cities and they're a bit more modern and urban. So obviously the risky sexual behavior is a bit on the high. And then there's issues of also migration in and out of those counties. And the fact that there's a lot of young people and schools and things like that, that contributes significantly because we are saying that young people is where the infection rates are higher.
Okay. Mora, where do you see the gaps and what more would you like to see going forward?
Well, I see the gaps when it comes to normalizing the HIV conversation because it's something we have not yet fully done. We have done it, yes, there are steps, but we have not fully achieved it because still people look at you in a shocking way, like you're talking about HIV, you know? So we need to come to a place where it's a normal thing. And if it is a normal thing, then we are able to actually address it. We are able to come up with better prevention strategies because the prevention methods are there. It's just that the uptake of the prevention methods is where the issue is. And we need to ensure that they are uptaking them and using them. So that, because people start on PrEP, they give up along the way. People start on PEP, they don't even finish the 28 days. People take condoms and they don't even use them. So we need to ensure that they are taking them and using them and just ensuring that they are protected because the prevention aspect is going to ensure that the new infections go down. Also when it comes to, I know they've said about the youth engagement and we need, there are more and more young people coming up opening up about their stories, and definitely they don't want to be left behind. They don't want to feel that all of this work that I'm doing, ensuring that I am there for people who are living with HIV, especially young people, and I am just, you know, like nothing happens to me. I'm just there. So they're not engaged in any form of way. So they keep doing it, and then they give up, like Dan said. So you can't keep doing that. You need at some point to bring them all together and tell them the work you're doing is significant. Continue doing it, because some of these people are doing it at the very grassroots levels. And we need to ensure that even their voices are heard and they're recognized, even if it's nationally, so that they know, let's keep doing what you're doing. Let's keep on at these support groups, because they are going to bring people together. And let's address stigma. Because one of the elephants in the room is always stigma. If we end stigma, we end new HIV infections. We ensure people living with HIV are on treatment, and they are on treatment regularly. And we ensure that they look at themselves as normal people. Because the issue of stigma always comes up. People will always, and stigma has now diversified. It's not the shaking of hands that we are afraid of anymore. It is the issue of now people will go online and talk about your HIV status. And the blogs will write about you and say, this person is living with HIV, and you will do everything you can to even deny it, that no, I do not have HIV. But until we talk about stigma, because stigma makes HIV look like a very bad thing, like a contagious disease that if you get it, you're going to die. So if we address the issue of stigma, then definitely we end up, even the 95 goal that UNAIDS has given us, we will achieve it by 2030. But we need to address stigma, because that is one big gap that has yet to be addressed. And the culture, the poverty, the education is still lacking. So the behavior change education is supposed to actually start all the way from primary school, going upwards, and even outside school, so that all of these people know that HIV has changed. The research has changed, the programming has changed. Now young people are being involved even in the funding processes. It is time that we now tell everybody. Because when I was, the first time I heard about HIV, I was in class 6. I did not even know I had HIV myself. And our science teacher was very specific and said, if you get HIV, you die. So it is time now we break away that narrative. And a lot of people grow up knowing that, because it is what we're taught in school. And school shapes a lot of ways in how we reason, how we do things out here. So once we change that, and I have actually seen some of the changes happening, and some people pushing for the life skills lessons not to be used as the catch-up for missed lessons on other subjects, but to actually be used around behavior change education. So that, because we have seen teenage pregnancies go on the rise, 2020, 2021. And when you see that, you know that these young girls, as they're getting pregnant, there is also a risk of them getting HIV. So we need to ensure that we are telling them, yes, you will be able to take medication, but no, it is not a good thing. It is going to be very difficult for you to take medication for the rest of your life. And you're just 14, you are 13, you cannot get pregnant at that age, and you cannot get HIV at that age. And it is time that we shape that even both boys and girls, they are able to be in a position of negotiating for safe sex. Because that is one of the powers that a lot of them do not have. And social media fuels that too. People look at the socialite culture, which we have actually normalized, and you see these people, they're catching flights, and you want to be that person. But most of the time, it's also funded by somebody who is also demanding for unprotected sex, because nobody is taking you from here to Dubai, and then you go there and say, now we want to use a condom. So which other ways are you using to prevent yourself?
How long have you known you're living with HIV?
Almost 29 years now.
29 years? All right. I'd like to know from you your biggest moments where you felt broken and the moments where you felt like we can actually win this war? Because I know through this journey there were moments where you felt that this is the worst experience ever, and there were moments where you felt that, okay, this is actually something you can win. But before we come into that, Rebecca, you're talking about the Maisha conference.
Yes.
Tell me about this. What is this going to achieve? How does it look like?
Yeah.
And what is the plan?
So every 2 years, so this will be the 6th conference. So every 2 years, the NAG holds the Maisha conference, which essentially brings together researchers, policymakers, scientists to tell us what is happening in the HIV space, and specifically highlighting the work that has been done in the country so far, but also bringing people from the international space to let us know what else we can implement in the country. So the Maisha conference this year will be basically discussing resilience and innovation, just simply because it comes from a place where we've had to deal with the COVID pandemic, and issues are like sort of on the rise. Specifically for HIV, our health system has been tested significantly. Are we able to sustain, you know, in terms of finances in the country? So this year's conference is really going to be around sustaining how do we remain relevant, you know, with COVID and resilient, and also making sure that we are, you know, the innovation is there in the country. And I would just like to say, with regards to what Mora has talked about, making sure that these young guys know that we are seeing the work that they're doing. So this year we'll also have awards for different people in different areas. In terms of researchers, we'll have junior researchers or younger researchers getting awards. We'll have people who are working in this community space as young people, as like in advocacy, and how can we show the country that we are doing something and that we are recognizing the work that they're doing. So we'll have awards this year as well, but also we'll have amazing panel sessions, and I think having conversations that are now relevant. You know, we'll have issues around HIV and COVID-19 being discussed. We'll have issues around sustainable financing being discussed. How do we how do we have a resilient health system in the country? How do we make sure that we're engaging young boys, which is a panel that's going to happen on Monday. And so on Monday and Tuesday and Wednesday, so the conference will be from 14th to 16th of this month, and it's going to be a virtual conference, and you can be able to register online and be able to participate and interact with all these panelists that we have from now. And I mean, with the benefit of it being virtual, we're able to speak with people from across the world. And so it's going to be an engaging platform, and we want to make sure that as many people as possible are able to get on the platform and interact and basically discuss issues that are now, you know, relevant with COVID-19 now, and just how do we make sure that as a country we make sure that everything that we are doing for the health system is actually brought together towards a success for the country.
All right. Dan, what are you looking forward to in the Maisha conference?
So for the Maisha conference, I'm looking forward to the awards, since I'm one of the young people who have been part of.
There's no rigging, Dan.
I have been part of I'm part of a group of young people who have been consistent in this space, sensitization of HIV. So I'm hoping to get an award.
Okay, but what about the conversations? What are you looking
in terms of conversation? I'm looking forward for the conversation about men. Since I guess the girl child has been empowered more to an extent that the boy child is under siege.
Do you want to start that conversation? It's just you and me.
So, win. I'm looking forward to get to know what direction we are supposed to take as young men, especially young people, especially young men, in this journey.
Okay. And Rebecca, there's another question that I've seen online. There are those young people who, once they get infected, and they're bitter about it, they say that they will not die alone. So they deliberately start to spread. How do you deal with such situations? Because there are those who feel very bitter. We've actually even seen some people post lists of people they say that they have infected.
Yeah, so I mean, obviously we can't deny that that's something that's happening, because a lot of young people who do get infected have not accepted the status. So either they are not going to stay on treatment, or they're going to take the opportunity to now infect other people. So I'm sure it has happened, you've had stories, but it's important to also know that it's not okay to do that. It's not okay to do that. Not to put the responsibility of disclosure on the person living with HIV, because that's not right either. You're supposed to be responsible for your own health, and it should be your decision to protect yourself and know the status of your partner. But it's not okay to infect other people. And I think that you should also take the steps to go to a facility and speak to someone, because that basically speaks to how you've taken the news and you haven't taken it very well, and take the time to understand HIV and understand that you can live positively with HIV. And so I think the first step you should take is to seek services at a facility where they'll do counseling and they'll be able to educate you, so that it can come from a place of now you know what you need to do, as compared to a place of bitterness. Yeah.
Because even that I will not die alone mentality still exposes you to more risk.
Yes, it does, because HIV is not the only risk. And we try to make sure that as we're speaking to young people understand that it's more than HIV. It really is. And when you look at the STIs that are there in this country, also among young people, significantly high, it's more than HIV. It really is. And if you look at STIs, an STI, it comes one, they come four.
Yeah.
It's never just one. And so I usually like to tell young people, make sure whenever you're eating your dinner, you look at your food. You make sure you're seeing what you're eating. Yeah. So before you're with a partner, make sure you're looking at what you're doing, because you have to see. The lights have to be on. I'm very serious, because
that's a very interesting perspective.
Because you see, in as much as you can't see HIV, you can see STIs.
Okay.
You can see STIs. So, and when you see an STI, you will put on a condom. While you're protecting yourself from STIs and pregnancy, you're also protecting yourself from HIV.
Okay.
Yes.
Also, I feel that the person who doesn't know their HIV status is the bad person. Yes. There's a quote which Becky keeps on saying. I would love if she said it.
So I usually say the person who doesn't know their status is the big bad boogeyman. Because that's the bad person. That's the person who does, that's the bad person. You're the one who doesn't know your HIV, you're the one with the problem. I know my status. I'm taking care of myself and my partner. You need to know your status. You're the problem.
Okay.
Yeah.
It's a bad big boogeyman.
Yes.
That's an interesting one. Yeah, you have to tell us about your lowest moments and your greatest moments in the 29 years that you've been dealing with this.
So my lowest moment was when I stopped taking my ARVs. Because I had the hope that I was going to get well and become HIV free, and then that did not happen. So there is that disappointment that comes with it. But it's not just the disappointment, it's a lot of people living with HIV are trying to get out of being HIV positive. And one thing, and I always tell people, this is a permanent thing. There is no getting out of it. So be very careful as you're going out there testing other people with your eyes. There is no laboratory in your eyes. It is just you and the person. And as far as you're concerned, this person might be HIV positive. They just are not telling you. So always use a condom. Like, I advocate for condoms more because condoms protect a lot of things, unlike just the other prevention measures. Condoms protect unplanned pregnancies, and they also protect other STIs. So as much as you're going out there and asking each other if you don't trust each other, it's not an issue of trust. It's an issue of there are infections, they are real, and you have to actually look at them from that perspective. So my lowest moment was actually when I stopped taking medication, because I had that hope that I wanted to be a normal person. But I forgot that I am still a normal person. The only thing is I am just hosting HIV for the last 29 years, but I am a normal person. When I came to that realization, that is now when I felt like I have now, you know, achieved something. Like, the moment you start being that you're more than your diagnosis, now that is the time you start winning. But also my greatest moment was when I was selected as one of the young International AIDS Society leaders, where we're creating a youth hub, a digital youth hub, to connect with young people across the world affected and both infected with HIV, to give them the information, to connect to them into international spaces. And that made me really happy, because I was like, finally I am, you know, shaping the conversation around this and helping these people from the perspective of a person living with HIV. Helping these people see that this is what we actually want, not just what you guys, you know, we are very much donor funded. And sometimes the donors throw to us the things they think will work for us, but then these things don't work. So when they don't work, what do we do? So at least I am finally happy that I get to be at the table where the decisions are made.
All right.
Yeah.
Brilliant. I'll give you a chance each for closing remarks, and I'll start with you, Dan. What is that one rallying call to the youth, that whatever it is, by the time we are done with this conversation, what is the one thing you want them to hear as a young person?
For me, or I'm speaking to the young
Speaking to
person?
the youth.
For me, I would say, I will urge every young person to weke condom pangoni. Safer is fun with a condom. Yes.
Okay. All right. Rebecca?
Yeah, for me, it's that young people need to take charge of their health. Just their health, whether it's sexual health, mental health, whatever health we are discussing at any point, young people need to make those decisions for themselves, and often educate yourself, know what you need, know what you want, make the right choices and informed choices for yourself. And the only way we can be able to do that is by making sure we know and asking questions. So for me, it's that, just make sure that you know and you're making informed decisions concerning your health.
All right. Mora?
For me, it's, if you're living with HIV, it's not the end of your life. There is more to life than your diagnosis. So live beyond your diagnosis. If you are not HIV positive, please stay HIV negative. And remember, your HIV negative status expires every time you have unprotected sex with somebody who you don't know their status. So stay negative. For whatever reason it is, don't be testing people with your eyes. Don't go about asking people if they don't trust you. The only trust that you should trust is a condom.
Okay.
Yeah.
Rebecca Nyankia, Program Officer, Adolescents and Young People, National AIDS Control Council. Thank you for making time. Doreen Mora, HIV activist and founder, I Am a Beautiful Story. You are indeed a beautiful story. Thank you for making time. Daniel Nyingi, Digital Strategist, asante sana for making time. Let's see what you're saying online really quick. This is a conversation that we will not just end today. We'll continue having it every single time we can. Kidor says one of the reasons as to why HIV is rampant among youth is because of high rate of unemployment and poverty. The youths get sexually exposed to rich HIV positive groups, hence getting infected. All right. Lucas Guaro says, good morning. I like the guts my dear sister Doreen has. Keep it up and carry on. I agree with her that most youths fear pregnancy than HIV infection. Eric says, let's believe, trust, and listen to the young people. Give them resources. They are the most creative and they have solutions as well. Jenga says, Mora is very right on how one should not allow the HIV status to negatively control their mind, but this needs a lot of sensitization, invest in advisory systems, because not everyone has the same capacity to positively absorb the status, all right? Oton Kiri says, I love the way these young people have come out boldly to change this narrative amongst their peers. Evans Wanjala says, a very good topic of the year, away from politics and budget, let youth know AIDS is real than saying Corona itaisha vile AIDS iliisha. All right. Mandela says, let's use this gold. Let's have safe space and wellness centers in our community. Give them resources. Let them be designed, led, and implemented by young people. All right. Brilliant. Thank you so much for all that conversation and all the feedback that we've received. This is a conversation we'll continue having on HIV and AIDS as much as we can. Stay out there, stay protected, take care of their loved ones, and most important, take care of yourself. All right, taking a quick break. When we come back, Roy T-Boy is on the decks.